On the occasion of our centennial celebrations, we have decided to conduct this webinar, and today we are presenting Pragmatic Approach Towards Thyroid Management, and is presented by Dr. A.N. Narayanan Nambi. Dr. A.N. Narayanan Nambi is presently the Director of Academic and Clinical Services of SNA Aushadashala, founded by Ashtavaidyan Thrissur Thaikadmos in 1920 in Kerala. He received BAMS degree from Mysore University and MD degree from Rajiv Gandhi University of Health Sciences, Bengaluru. He is seeking for PhD from SVSVMC University, Kanjipuram. He has been contributing in the field of Ayurveda, education, healthcare and policy matters in India and abroad since 20 years. So I'd like to welcome him, Dr. Narayan Nambi, for the presentation.
Thank you, Nisha. So let me share the screen. Is it clear and audible to all of you?
Yes, sir. Yes.
Shiju, is it okay?
Yes, it is. Yes, it is. Yes, it is.
Okay. So first of all, I'm thankful to our Managing Director, Ashtavaidyan PTN, Vasudevan Moose, and SNA's Marketing Manager, Sri Jayakrishnan Nambi, and his team, Shiju, Nisha, and all the team behind this organizing an event program on pragmatic approach in thyroid management. I think it is a very right time to discuss thyroid disorders and its management, because there are many reasons to say so. As we all know, when March 24th onwards in India, we had lockdown, which was extended for many, many weeks. Probably one of the most challenging health damage might happen in the physical plane was the thyroid, and secondly, it is in the mental level. Why? Because when we have been not permitted to go out, rather we are forced to sit inside, most of the people started experimenting many type of food inside the house, started eating unauditably, and enjoying many different tastes of food made by wife, and really had a wonderful food. But unfortunately, since they are not permitted to go out to do some exercise activities, many of the people seriously gained their body weight, and also many of them had a real change in the hormonal levels. So at this point, I personally, as a clinician, when I started my clinical practice few months after the lockdown, that means around June, July onwards, many of the thyroid patients came back complaining that now my thyroid functions are completely out of order. So at that framework, it is a very important to look from the thyroid management in a very, very pragmatic way, so that we could able to arrive into different complexities of this system, not simply prescribing an levothyroxine or alproxine. As you all know well, that thyroid disorders are one of the most commonest disorders in endocrine system. You may be surprised that instead of telling diabetes is the most common disorder of endocrine system, but in reality now the thyroid disorders even overtaken, at least numerically, it is overtaken many of the diabetic conditions, and it has become one of the most slow progressive disease, with about around 42 million people suffer from thyroid disorders only in India. Maybe it may be even smaller amount compared, because the data I've taken was around 5 to 6 years before. There are no recent study available for detailed information. And very interestingly, there was a general notion that women are common to get thyroid dysfunction, and they are more prone for getting thyroid disorders, and men are relatively less. Okay, statistically it may be true, but when it comes to the reality, as a endocrinological person and as a practicing thyroid doctor, I find a lot of male patients come across in the clinical practice with the thyroid dysfunction, often even very difficult to treat uh, male thyroid people than women. And also, there are many studies shows that thyroid cancer is alarmingly increasing, and when it comes to the male, it is even more complicated and very difficult to treat. Under the big umbrella of the thyroid disorders, we have many disorders, as you know well, that like hypothyroidism, hyperthyroidism, goiter. Goiter is not really an independent disease; it is just an hypertrophy of the gland itself, and many other iodine deficiency disorders, like in association with the parathyroid and all, and some autoimmune manifestations like Hashimoto thyroiditis, and at last there are thyroid cancers. And out of the whole list of diseases what have been mentioned, hypothyroidism is the most commonest disease uh, as a functional disorder of thyroid gland, which could be really need a medical attention and really care, because most of the people are really fed up with the existing medical system. Every one in Many of the statistics says that every 1 in 10 is affected with hypothyroidism, and many times the symptoms of the hypothyroidism is much mimicking to the common fatigueness, common premenopausal syndrome, common anemic symptoms, and so on. Because of this itself, it is many times a bit late to identify these dysfunctions, and when it comes to a medical attention, it may be a little bit late, and they immediately switch on to the drugs. In the society, in the reality, or the pragmatic way, if I speak, there are two categories of people diagnose this case. Some of the people, they are very close to the social media. Those are very active in the internet platforms, and they are conscious about health and health-seeking behaviors. If they have a hair loss, they have some joint pain, etc., etc. By reading these type of popular series magazines or the WhatsApp videos and all, they may go to a laboratory and randomly check the thyroid dysfunction just by self-care, and they may come up with a positive result with the TSH is high, like 10, 20, like that. Another set of people, they really ignore or they really doesn't know about anything about thyroid dysfunction, and they may complain that I'm having some symptoms like neck pain, joint pain. There are many symptoms, and a clinician may initially think that this may be related with arthritis, this may be related with hormonal disturbance, etc., or even for some skin manifestation. But as a clinician, they may suspect other diseases, including the thyroid dysfunction, and so they will ask the patient to check the thyroid function, T3, T4, TSH, and they come up with a positive result. Most of the time, once they get diagnosed with the thyroid dysfunction, if we are not very keen to that, most of them, they will directly go to an endocrinologist or a general medicine doctor or an endocrinologist. So when they meet an endocrinologist, immediately they will see the reports and they will ask the patient to start the levothyroxine. It depends upon the range of the TSH level, depends upon the symptom. They may start with the 25 mcg or 50 mcg or 100, even up to 100 mcg. Normally it should not be done, but still a small amount, normally 50 mcg in the morning, empty stomach dosage. But the interesting fact is that once the thyroid supplementation starts, after a period of time, they feel initially they feel very comfortable. There is no much problem, but after a period of time, even with this dosage of thyroxine, they manifest many of the comorbidities or the symptoms of the hypothyroidism itself, even though biochemically normal or with a biochemical abnormality too. So they go to the doctor again, and the doctor will say, you have to continue the same medicine for next rest of your life, and maybe I will increase the dosage. So since the patient is not really very happy with the increase in the dosage, and moreover, they may think that this is not a very serious disease like an insulin dependent diabetes mellitus. Why can't I think about an alternative medical systems or other medical systems in this country like Ayurveda, homeopathy, Siddha, etc. And this makes this call out of help. This makes the people to rush into Ayurveda directly or rush into homeopathy directly, and they will come up with a different question. They will come to an Ayurvedic doctor and ask, doctor, do you have any similar disease in Ayurveda like hypothyroidism? Definitely, we don't have anything like that, because thyroid dysfunctions are very, very. I will explain that. Anyhow, so these people will come up with a lot of questions to a clinician and say that, oh, doctor, I have thyroid dysfunction, and a modern medical doctor asked me to take levothyroxine. Now I am taking 50 mcg from last 1 year. Initially, I found very, very good. My hair loss become better. My joint pain become better. I feel more energetic. I'm really comfortable. But over a period of time, I was not really very happy with the dosage of medicine, or I was not very comfortable with the existing things. So what shall I do? So from this point, actually, the real thyroid study, I mean thyroid approach or thyroid approach to Ayurveda will start. And so the issue is that they have many questions in their life. It is not a matter of money, because levothyroxine is not at all an expensive medicine, and it costs maybe few rupees per tablet, and it's a very easy to consumable and everyday morning. So many people will stick on to the existing medication, but the big challenge for the general people is because of the drug dependency, as the doctor says a statement that you have to take this medicine till the end of your life. And moreover, this long lasting therapy many times hurt personally to many people. For example, a girl age of 20, 22 taking thyroid dysfunction, but she is getting married. So many times the family members of the girl might be looking for an alternative to cut down this medicine, or at least to stop this medicine forever. So there are situations people really looking for an alternative, and they really rush into Ayurvedic people what we can do. So there is a real space. That is a real space. Seldom we get people with a freshly diagnosed case, but if you are specialized in endocrinology, specialized in thyroid dysfunction, of course you will get many patients with that. But otherwise, normally we get different type of people. One category of people, they are already taking levothyroxine and they are looking for an alternative. A second possibility is that they come up with goiter, the real enlargement of the gland, and when the medical doctor says to them that you have to undergo a thyroidectomy, so they may be looking for an alternative Ayurvedic approach. So I'll come to that point. So if you want to know what is happening as so far Ayurvedic medical system is concerned, we have to remember some of the basic things in the Ayurvedic medical system as well as in the modern medical system. Since the audience are learned scholars and already medical background, I don't add this type of literary content, because you already know this thing that and that hypothalamus makes a hormone called thyroid releasing hormone, and this will stimulate the pituitary, anterior pituitary, to produce TSH, thyroid stimulating hormone, and it transfers this message to the thyroid gland, which is situated in the neck around the trachea, which is a butterfly shaped gland, and this gland produces tetrahydrothyroxine, which is called T3, as well as T4, and trihydrothyroxine called T3, and these certain amount of these two hormones, according to the need of the body, it diffused through the circulations and reaches to the almost every part of the body. Basically, it is like a battery of a mobile. So thyroid gland is almost like a site of Agni Sthanam in Ayurveda, because it basically controls the basic metabolic rate of the body. It also controls the glucose catabolism of the body, or lipid metabolism, appetite, protein synthesis. It's almost they needed, just like a battery is needed everywhere in any system we need, because it is a powerhouse of everything. Exactly the same here. Thyroid hormone is needed for almost every part of the body, irrespective of the area. So it needed in cardiac, musculoskeletal, nervous, even reproductive system. Everywhere it is have its own role. So if we keep that idea and looking from Ayurvedic perspective, the whole story can be categorized in such a way that it's have a close role with different type of vata, as you can see in the slide. So we have prana vata involvement, udana vata involvement, samana vata involvement, and vyana vata involvement, and there is a feedback mechanism has happening. And then the bottom, it's almost the Agni is directly related with the Dhatu Agni. So every dhatu have a dhatu agni, and every dhatu is really not nurtured through dhatu agni with the help of samanavata, and that's the things are going. So fundamentally, we can imagine that there is an involvement of almost all the five vata plus agni in the various levels. And if we look at the presentation too, in the hypothyroidism, what you can see is that there is a kapha vriddhi lakshana, like Guru Gatrada, Ariji, Vaksanga, like all kapha vriddhi lakshanas will be there, because the dietic style people do, which create kapha vriddhi and create an agni-mandya. So they will have asweda, absence of sweat, and they will have agni-mandya, and they feeling intolerance to the temperature, etc. And this Agni-mandya over a period produces ama utpatti, and that ama will go to the Rasadhatu, primarily Rasadhatu, and later on to other dhatu. That is the reason why Charaka mentions that Rasapradosha Vigaras like Asadha, Asyavirisa, Varsachada, Hamlas, Ogavaram, Tantra, this type of Rasapradosha Vigaras, most of the Rasapradosha Vigaras we can see in the initial phases of the hypothyroidism. So as there is no direct references exactly what is the name in one chapter, so it is one way it is bit difficult for an Ayurvedic clinician to understand. Why? Because there is no direct description. Just like if you have a description like stroke, we have Pakshagada. If there is an Ardhida, then the Bell's palsy, we have Ardhida. If there is a sciatica, then we have Grudrasi. Like that, there is no direct disease correlation is not available in the literature. But if we go through the details of the descriptions in some of the chapters, like in the context of Pandu, in the context of Samajwara, in the context of different chapters, we may find some of the Samprapti plane, some of the dosha plane, some of the details which could be really proximal to or nearer to the hypothyroidism. So let us back to the symptomatology. So normally the people will complaining of fatigue or the weakness, weight gain, constipation, or like dry skin, edemas, sometimes cognitive dysfunction like depressions, muscle cramps. These are some of the commonest symptoms they do, and clinically also hair loss, hypothermias, or bradycardias, etc. And very oftenly this has to be differentiated from anemia as well as hypothyroidism. People with obstructive sleep apnea is one of the most common disease nowadays with the people with other metabolic syndrome. They have obstructive sleep apnea. They are also prone with these type of above told symptoms. Dementia, adrenal insufficiencies, Lyme disease, vitamin E deficiencies. These are all have very similar presentations of hypothyroidism. So we have to take into consideration of these. But nowadays, generally the clinician, 80% of the diagnosis should be done by the clinician, not in the lab investigation. Rest is only 20% has to be made by lab investigation. But nowadays the medical practice in the is done in the vice versa. Whenever we find one or two symptoms, we really jump. Most of the clinician will jump into a laboratory investigation so that we can quick fix the condition and progress further. But it's not really good. We have to do a real physical examination, whether it is an Ayurveda or a modern medical science. It is important for a clinician to do physical examination in a very detailed manner so that it is his intellectual potential to explore and to know the details of a disease, which is also very good for him to intellectually to keep his brain very sharp. But nowadays people will simply, okay, let us go for randomly checking for T3, T4, TSH. And okay, somehow the TSH is high, 20 or 25. Okay, now the person is already labeled as thyroidism. There is a lot of problem in that. So in reality, this is the basic thyroid evaluation thing. If we have to really, first we have to see, as I mentioned the slide, the fatigue, weakness, weight gain, constipation, these types of symptoms. At least we should find these type of symptoms. And also some of the signs. There are simplest signs also. So for hypothyroidism is concerned, if you ask the patient to keep the leg over the chair, ask the patient to stand and keep the leg over the chair and do a small tap on the backside of the foot, especially in the Achilles tendon. If you make a tap on the Achilles tendon tapping, if the response is very slow, it is one of the commonest signs what we can see in the hypothyroidism, even in the subclinical level. But anyhow, most of the time, the routine examination are poorly done by most of the practitioners. I don't blame anybody, rather, but it is also very important to know these things. So this is a framework for evaluation of the thyroid gland. As you can see, there is one side I put the TSH, which is the commonest test we do to know the situation. And another side is the free T4 or the free thyroxine. Instead of doing T3 and T4, free T4 is the better evaluation, give a better thing. So if you find TSH is high and free T4 is low. Free T4 is the hormone which is a T4 that is circulating in the blood, and this free T4 losing by its one iodine, T3 become the most receptive part of the thyroid hormone to the cell. T4 is not as easily perceptible to the cell, but by a large amount of T4 will be more generally in the blood rather than the T3. So if we examine a case and if they come up with TSH is high and T3 is low, then fine. It means it's a primary hypothyroidism. But in the other side, if it is free T4 is low and TSH is also low, this is secondary hypothyroidism, means you have other disease. They may be taking thyroxine and this thyroxine dose may be went into slightly higher and the TSH all of a sudden fallen down to lower margin. Again, if free T4 is low but TSH is normal, then we have to consider the non-thyroid illness. There are other situations also thyroid can change, like a pregnant lady. Some of the pregnant ladies may have, if you do a high, the mountaineering, the high energy burning activities you do, like a long fasting you do, T4 can change. Then comes to the secondary, then this is the lower end, you have hypo and hyper, whereas the other side, if the TSH is low, whereas free T4 is very high, then that is primary hyperthyroidism. And as you can see, the other side, secondary hyperthyroidism, etc. Again, you see this TSH is high, but the free T4 is normal, then it's called subclinical hypothyroidism. This is a very quick chart. You are able to know, it's very simple. You are able to know how a diagnosed condition is conducted. Most of the time, many people will get this type of thing as a pattern of thyroid dysfunction. If you, nowadays, when you go to lab investigations, along with the report, you have the normal abnormal scale is depicted like this. This also gives better informations too, but I prefer the previous one because that's more accurate than the this thing. Now let's come to the treatment aspect directly. Before that, as you know very well that there is a possibility of hyperthyroidism, and there is also possibility of hypothyroidism. So if there is a increase of hormone level, that means TSH is very low and free T4 is more, then it is a condition called hyperthyroidism, which is not very common comparing to hypothyroidism, but still, in this hyperthyroidism, we have the symptoms of the opposite. We have arrhythmias, we have very Pitta Vada symptoms, whereas in hypothyroidism, we have Kapha Vada symptoms. So if you have a very Pitta Vada symptoms like tachycardia, like excessive sweating, loss of protein from the body, because of that they will have they're becoming lean, they have mood fluctuations, etc., etc. So we have to treat such case with this way. So what we have to do, we have to manage the pitta. So we may use pitta hara kashayas like drakshadi kashayam, which is mentioned in the Jara Chikitsa, draksha madhuka madhuka kashmiri shariba, that kashayam, or Vidari Kashayam, which is told in the Shodhanadikana Sangram, that Vidari, Vanjangla, Vichigali, Vichiga Deva, Supyavarna, that yoga. Very good. Also Hridyam. Or in the Kushta Jigilsa, there is another very nice Pittavada Shamanam Kashaya called Tiktaka Kashaya, Padolan Bagaduga, Darvi, Padhaduralaba, Parprandrayamanam Chadat Yogam. These three Kashayams also, depending upon the co-association, if the person is having temperature irregularities, intolerance to the temperature, if the person is having more vata associations, other symptoms, then better you opt for drakshadi. But if the person is having cardiac arrhythmia is thing, person is telling I have a chest disturbance, person is telling I am feeling giddiness, better you think about vidyadyadi. If the person is telling I have angioedema, I have eruptions, I am feeling very itching all over my body, the person is telling I feel very too much of thirsty and all, better you, instead of drakshadi and vidyadyadi, you opt tiktaka. Again, the toyam, simply the water preparation, which is just like our shadangam mentioned in the jora, chariba chandana ushira, can be of another very good usage for the patient who can drink this. Then, since what type of ahara, since this is a condition of atyagni, so we have to give food, sandarpanam, we have to give guru, but not too much of sandarpanam. The medicines like Kalyanaka Kritam could be very, very useful at this stage. And also mild relaxation could be very nice, like Avibhattikara Churnam, Sarve Sama Samusida, Chaudrena Gudigi Kirta Yogam. Or we can do Chira Kashaya with Truvut Syama, etc. Excellent result can be achieved with the Talapodichil. There is a treatment which is in which we make the different head pack in the head also. Generally, Snehapana and Swedana can be done. No, Swedana is not so indicated at this stage, but we can do Snehapana, like Snehapana with a Tiktaka Kridam or Mahatiktaka Kridam, and followed by mild Virejana. That's one approach. Or if you are looking for other symptoms where you have more Rukshada is there, more Kaphanibandhatvam is there, then instead of using the Akshadi Vidaryadi, you may opt for Mahatiktakam, Padoladi, Shadavajyadi like Kashayams, also very good. Since most of the thyroid dysfunction, especially hyperthyroidism, people will have a lot of gut disturbances, especially they often complain of constipation. Sugamara Merendam is a very good medicine. We can use a Shadangam, that Khanachandana Shundyambu Parpado Shiri Sadidam. Take out the Shundi, it's not needed because it will increase Pitta again. And remaining other medicine can be of very good choice. Again, the Vidaryadi Kashayam, which can be used as a Kshira Pakam or Parushagadi Leham, Kushmanda Rasayanam. These are excellent medicines. It brings thyroid, hyperthyroidism in a better way. Along with that, you can also use some of the Rasaushadhas like Pravala Basmam. You can try Kamadugarasam, excellent, especially gut-related manifestation. LSS, Legosudashegara Rasam with milk, 1 to 2 tablet 2 times a day, or Shangavasmam. These are also very good. These are all Pitta Vata Shamana medicines can be very used. Now come to the hypo. Hypo, the situation is the other way, where we have to do Kapha Vada representations and we have to prepare body to have a better Agni and have a Shodo Shuddhi. So Shodo Shuddhi, then we have Agni corrections, etc. So we may use Varanadi Kashayam, the famous Varanadi Kashayam, or SNA may be using Hamsavatyadi Kashayam, Guguludiktakam Kashayams are the most common prescriptions. Panchakolam Kashayam, again Panchakola Toyam. Instead of drinking plain water, they can take Panchakola water every day. It could be of very good usage. Food has to be very, very typical at when hypothyroidism is concerned. Since we have a lot of hypothyroidism patients, we have to have a proper diet plan for hypothyroidism. I will come to that point. Another excellent medicine for hypothyroidism is usage of Dadimadikridam. The yoga mentioned in Ashtanga Hridayam, Pandu Chilsa, immediately after the first slokam. Panduamayi Pibedadu Kalyanagahuyam. The next line is Dadimat Kudabodhanyat Kudabadram Palambalam Chitragam Shingi Veramcha. That yoga is excellent medicine. Even if you get even fresh hypothyroidism, so you may doubt how if the person is having some symptoms of ama, patient is having symptoms of kapha, how can I give a gridam? Don't worry, Dadimadi Kridam will not produce any amavastha in the system. Dadimadi is excellent in the context of correcting the Agni. So you can try. I tried many cases when the people freshly diagnosed case with TSH level 40, 50, no medicine. They are not started any ultrasound, simply giving 1 teaspoon of Dadimadi Kridam every day morning. And after 4 to 5 weeks, checked again the TSH drastically down. And patient also feels symptomatically very much relieved. Their bowel become normal, their appetite becomes slightly improved, like that. Again, we may use some of the laxatives like Nimbamradi castor oil, like Sindhu Arerandam, like Chira Kashai with Truvurchyama can also be used. Treatments, if normally hypothyroidism in the initial stage, patient never agreed to come to hospital and have treatment. If it is an autoimmune manifestations like Hashimoto, maybe they will come. But if there are people ready to come, if we do a treatment like Udvartanam and Takradhara, it will give excellent result. If it is an adolescent age, I often recommend Vamana because it can have a longer corrections, especially 16 or 17 years girl who is having hypothyroidism. It may hamper her reproductive life. When she get married, there are possibility that this girl may have difficulty in consumption. Even if she conceived, pregnancy happen, there may be some challenges in the growth of the baby, like cretinism may happen. So to avoid such things, it is better to have Shodhana Chikitsa, like Vamana shown very successful result. Raktamokshana, again, if there is a nodular goiter situation, there are many studies. I personally didn't done many cases, not at all with the Raktamokshana. But there are studies from Trivandrum Ayurveda colleges and some other colleges, the leaching, the Jaloga Vacharnam in the neck shown very good result in the thyroiditis as well as in the Hashimoto thyroiditis as well as in the nodular goiter. Medicines like which is mentioned in the Prameha context, like Ayaskardi, Gomutra, also shown very good result. So common prescriptions are Hamsavatyadi Kashayam or Punarnavadi Kashayam, Kanjanaru Uglu, Gaishwaru Uglu, Rasasinduram, very good, very, very good for correcting the Agni. Annavedi Sinduram, Soyamagni Sinduram, Shaddharana Churnam, that is the powder mentioned in Sushruta Samhita for the Amashe Gadavata, also shows very good result. Again, if it is an Hashimoto thyroiditis, it is better to use more in a detailed way. So we may also use Rasausadas too. So initial first stage is better to do with the Pitta Shamana. then go to Kapashamana, then go to Rasayana. So initially may start with the Prabhala Vasmam, then go to Kasisam, Loham, like that, just like Annabhedi. Then go to Swayamagni Sinduram, like that. Or may start with respiratory symptoms, then Apraga Vasmam, go to Shilajadu or Tala Vasmam and Manduram. Like that, we have different options so far these medicines are concerned. Uh, but very interestingly, in this hypothyroidism and menopause have very commonality. Even though this may be differentiated if we go very deeply into the symptomatology, but many times when a female with a 45 years complaining of body aches, swellings in the arms, legs, muscle tenderness, hair loss, many times this may be of a premenopausal syndromes. So it is really challenging to differentiate. But nowadays, with blood investigations, we may come to a conclusion. But very interestingly, there are also symptoms which not stand out in this level. Like many people will have arthritis feeling, many people will have muscle cramps in hypothyroidism, even heavy menstrual cycles in hypothyroidism. Normally, when we believe that a disease manifestation with kapha, there should not be a heavy menstrual cycle. Okay, maybe vata can induce, but most of the time when we have a kapha dominant system, we are expecting a scanty menstrual cycle, right? So instead of that, heavy menstrual cycle will happen. So beside the above prescription, it is also very, very important to have a tackling the kapha and medo vrutti. So we have to have basic kabhara measures, kabhara treatment. There are even also that yoga also we have a very, very good result. There are many yogasanas are also very successful in giving very good result in the hypothyroidism. What are the general measures? One simplest measure is upavasa. If we do a mild fasting or an intermittent fasting, it is also very good for the thyroid to correct if it is a small TSH is slightly high. Otherwise, we have to have a proper diet. Kabhara food like ruksha, alpa, katu, ahara should be there, but not increase too much of vada too. We can do Dvartana, Ruksha Swedas are very good. Vyayama and yoga breathing practices are also very good. Lekhana Vastis, there are special Vastis which have Lekhana property medicine also can be effectively used. Vamana, Nasya, Dhumapana, according to Avastha, we can make use of. If at all not able to do these things, at least if you ask the patient to take Shundi water every day, Panchagola Jala every day, that itself is a very good initiation in the management of hypothyroidism. And moreover, there are Lekhana Vastis are there. This is a classical Lekhana Vasti practiced by Dr. Padmanabhan, who was a DMO, district medical officer in Wayanad. So he was using this. So I just keeping courtesy of him. So he mentioned a Vasti which is having Kalka as Yavanyadi, Prabhala Kashayam, Dhanyamlam Yaksharam. And later on, he himself has modified this yogam instead of using this Pipalyadi Anasana Dailam, Kalkam, Hingojadi Churnam. And this was the shown very, very good result if the patient permitted to get hospitalized in the hospital. And moreover, if the patient get other manifestations like hormonal menopausal issues or other symptoms, Vasti could be of better use. And also in Hashimoto thyroiditis, Vasti can be a very good choice. Then there are things which has to be very, very carefully remembered. First of all, generally in the hypothyroidism, Snehapanam is not at all good. Not at all good. Because if we do Snehapanam, most of the time it doesn't come up with a good result. Okay, we can do, the Avarohana like Shodhananga Sneha, but the Adimadikritam is working very well. Generally, milk and milk products are not showing good result at all. So we have to, it is better for the patient to avoid milk, cheetah, dathi, ghee, all the milk products. Maybe takra may be better if it is properly prepared, which is removed by the butter. And Abhyangam oil massage every day, again, it's also not very good. Even though patient complaining of some joint pain, many times the Vaidya may prescribe some oil application. And maybe after some days they feel very uncomfortable with this oil application because of the thyroid dysfunction. So better not to use oil applications. And also very, very importantly, avoiding the day sleep. Divasopnam should be avoided because most of the time it is stimulating, it's not at all stimulating the thyroid, rather inhibiting the thyroid. So now let me, since there are scholarly audience are hearing my lesson, so I just also put some of the case studies so that it will be very interesting. These are not the ordinary cases of hypothyroidism, rather these are some unusual presentation of the thyroid. So after that, we may also have some discussion on it. So this is one, a girl came 2017 with a report that you see the report is that T3 is 103, T4 is 6.9, TSH is 10.29. Okay, 10.29, 10 is fine at the age of 14 or 15. Okay, but look at the TPO, which is supposed to be less than 40, maybe 70 or 80, maybe high. But look at the here, the TPO is 600 international unit. And also look at the TATA, thyroglobulin antibody ATA is also very, very high. And this girl has been consulted to a doctor, and she has been, the doctor, who is an endocrinologist, advised her to take Eltroxin 25 mg daily for a few months. But she was not very happy with this Eltroxin because even after taking this, she feels very difficult and she feels lack of energy. She feels complaining of some memory disturbances and all. Okay, biochemically, she may be feeling better, but biochemically, but functionally or symptomatologically, she was not happy. So she came to my personal clinic, and I started giving her medication for a few months. And again, I just reviewed the condition to check it for the neck, and the impression was the thyroiditis. And also, but parallelly, I also checked the TSH. So TSH become 8.46. So here the TSH level was 10.29 and it become 8.46. And anti-TPO didn't, it responded quite well. Anti-TPO, I forgotten the add about the anti-TPO, it came to the nearly 100. So this shows that this is a unusual presentation, such cases that, but normally such cases, I don't recommend directly to stop the modern medication and to switch on to the Ayurveda exclusively. Rather, I prefer a combined therapy. Why? Because a girl of 14 years age is very much active. They need a lot of growth hormone. They need a lot of hormonal push. Their reproductive life is just starting. She started menstruating. She is developing secondary sexual characters. So her body needs a lot of energy. So maybe if I switch on to Ayurveda exclusively, it may hamper her growth, and over a period, it may, I suspect, this thing. So instead of stopping Eltroxin and switching on to Ayurveda, what I have done was that biochemically I continued Eltroxin, but she was more happy with the medicine what I'm giving because this was giving symptomatically more comfortable, easy, and she feels very happy with that. That's a very interesting situation. But we have to be very careful when we deal with this type of aged girl. Okay, at this age is fine, but if you are treating a hypothyroidism case with 22, 23 situations. Because what happens is that sometimes they will start with Ayurvedic medications and sometimes they will drop these medicines. And when they get conceived, after a few months, doctor will detect that the patient, nowadays, most of the gynecologists have a regular screening of thyroid. It's a good thing. But they will say that, okay, if they have forgotten to see this after first scanning, third month or fourth month, they will say that child is having some abnormalities. Nose is not visible, something, some area is not visible. So they will say maybe you have to do an MTP, medical termination of pregnancy. So it may be a little bit stressful to the couple. So when we are treating a age period, especially the reproductive age period between 20 to 30, we have to be a bit careful to switch from modern medicine to Ayurveda because, okay, it may be possible. We have done cases, but it may be possible. But if you are not really confident about this, better to work together, Ayurvedic medicine as well as Thyroxine. This is another case. This is a communication. I seen the patient directly, but this is a communication between the patient. She was an Ayurvedic student, so it was more easier for me. So you see, one patient, she had T3 for 35, T for 21, TSH 0.01. So the student was telling that Rakshadi Kashayam, Kanjanaru Gugulu, and Dadek Madi Kritam, and Panchakola Churnam is given. So I told her, no, okay, now you switch on. Better you give Tiktagan Kashayam Vidadyadi, not Hamsavatyadi and Kanjanaru Gugulu in all cases. So then I given Tiktakam Vidadyadi Kashayam Guluchyadi for 6 months, and she says now the TSH level is the same, remains the same. T3, T4 level improved in hyperthyroidism, but the level remains 0.01. So now the allopathic doctor advised to do thyroidectomy if there is any options. So I asked her to advise to take this patient IP treatment required. They are ready to do IP treatment, symptoms. So IP treatment started, weight gain, tremor, palpitation improved well. So like that, this is a communication regularly happened with another patient very successfully. We could able to treat. So this is also possible. Then another case, this is so we start a case of 14 years, then a case of middle age, then a case of old age. So this is a case came in the clinic with a multinodular goiter, involved both the lobes of isthmus of thyroid in 2015. And she started taking some medications, and later on she dropped. She thought that, okay, now it is not necessary thing, so she just simply dropped the medication. So what happened after 2017, see, the size is increased. Multinodular goiter is size has been enormously increased, and biochemical changes looks everything normal. So what she has done was that actually in 2015, this was the problem. When 2016, she had a scanning of the neck and shows that there is a nodular goiter, and she started the medication for some time. Then she herself decided to stop the medication. To convince her statement, she went into laboratory and checked T3, T4, TSH, find everything normal. So all of a sudden, she stopped the medication. That's the reason why after 2 years, there is an increase of it. This is another interesting thing. So whether we can do Ayurveda treatment, yes, there are, if the nodular goiter is a small, if it is not having much tendency to the malignancies, we can use local lepams like Grihadumadi, Lepachurnam with Dhanyamlam can reduce the swelling. If it is thyroiditis, maybe Kotanchukadi Churnam with Dhanyamlam. There are, if there's a more Pitta dominant, we may use Guluji Patradi. It can also reduce the swelling if we do for the longer period. Then comes the last case. This is also another interesting case with a well-defined hyperchondrial nodule, 6 centimeter in this, and you can see the thyroid TSH is 0.5, and later the mild thyroiditis, and changes are significantly made. This is a 40 years condition, and look at here, all the biochemical things are normal. So medications are given. Mild thyroiditis is there, no benign tumor. This is another conditions where benign cystic swellings are there. So we have to go for surgery if the situations are not present. So by this, so in nutshell, we can treat most of the thyroid dysfunctions except the thyroid malignancies. In really, if it is a really thyroid malignancies, maybe we can treat, but still, by and large, we get the patients of hypothyroidism, and we can very effectively we can treat hypothyroidism even without the help of thyroxine, levothyroxine. And the patient who have already have taking thyroxine with Ayurveda, definitely we can withdraw slowly and replace this long-term thyroxine into Ayurveda for a period of time, and lately we can stop that also. Some of the best medicines for hypo is Dadimadikradam, Hamsautyadikashayam, and Kanjararagugulu. Some of the treatment I strongly recommend is Uddhavartanam and Lekhanavasti. But again, we have to remember that people are different, people's Agni is different, Ama situation is different, hence management should be always based on the presentation, clinical manifestation, as well as the Avastha. So that's all. I think now we are already spoken for nearly 1 hour. So I'll stop here and I will open for questions.
Thank you, Dr. Nambi. We will go ahead and take some time for questions now.
For that, we have some doctors are here to share their experience. Hello, can you hear me?
Yes, yes.
Okay.
Okay. We have some senior doctors here to speak new words and their own experience here. So first of all, I invite Dr. Mahesh.
സ്ഥലം പറയണം.
From Andhra Pradesh.
From Andhra Pradesh, I think. I didn't get the place. Andhra Pradesh, right?
അൺമ്യൂട്ട് ചെയ്യാൻ പറയണം, അത് പറയണം കൊടുക്കണം.
I hope Dr. Mahesh can hear me. Doctor sir, are you there? Okay, we'll invite later. Another one I will invite Dr. Pavan Mishra from Chhattisgarh. I will invite Dr. Mahesh later. So now I am going to invite Dr. Pavan Mishra from Chhattisgarh. Sir, are you there, sir? Dr. Pavan Mishra.
അല്ല, അൺമ്യൂട്ട് ചെയ്യാൻ പറഞ്ഞോളൂ. അൺമ്യൂട്ട് ചെയ്തിട്ട് സംസാരിക്കാന്ന്, അതൊന്നും കേൾക്കായ.
ആരുടെ എന്റേതാണോ അവരുടേതാണോ?
അവരോട് പറയണം അൺമ്യൂട്ട് ചെയ്തിട്ട്.
ഓക്കെ
അൺമ്യൂട്ട് ചെയ്ത് കൊടുക്കാം എല്ലാവർക്കും.
അൺമ്യൂട്ട് കൊടുത്തോളൂ എല്ലാവർക്കും.
ഫുൾ അൺമ്യൂട്ട് ചെയ്തോളൂ.
Srinivas Rao is raised his hand. Sir, wait there. Before that, we have some sessions here. Some senior doctors are here to share their experience. So please wait, Sir Srinivas Rao. Dr. Srinivas Rao is raising his hand. Please wait, sir. I will come to you. Now we have some senior doctors. Sir, Pavan Mishra from Chhattisgarh. Krishna Mandhya from Andhra Pradesh, Dr. Vivek, Dr. Venugopal, Dr. Chandrasekhar from Hyderabad. The following doctors. Yes, Dr. Mandas, I will come to you. Please wait.
Hi, doctors. You can unmute yourself now.
Dr. Chandrasekhar from Hyderabad. Can you hear me, sir?
सीधा इधर की एक टीचर थी बांसवाड़ा में टीचर
Sorry, your voice is not audible, sir.
ഞാൻ പറഞ്ഞു കൊടുക്കുന്നില്ലേ സിസ്റ്റർ?
Yes, കേൾക്കാം. I think now you can unmute yourself.
Please unmute yourself, sir. Dear doctors, please unmute your
If anybody
microphone.
needs to share something or ask questions to
You
Dr.
can do it now itself.
हेलो हेलो मैम
Yes, yes, yes. Dr. Mohandas, I think Dr. Mohandas, right? Mohandas Rao.
No, I am Dr. Sadanand from Karnataka, sir.
Okay, sir. Okay.
First of all, I am very thankful to you all and SNA. Hello. Hello.
Yes, sir.
Yes, yes. We can hear you, sir. We can hear you.
Is it
We can
audible?
hear you. Yeah.
Yeah, sir, I am very thankful to SNA. We had very wonderful session by a resource person. My question is whether we have to treat hypothyroidism through Vamana, by cleansing method. So, will you elaborate that Vamana, in which Snehapana should be done and what should be the Makadravya?
Okay. There are practical as well as experimental study conducted on Vamana on the hypothyroidism shows significant results in reducing the ama as well as improving the agni. For example, 1 month back we had a case with the TSH 50, and what we have done is simply we have done a Sadhya Vamana itself, and after 15 or 20 days we checked again, and it shows that there is a change in the TSH level. It came from 15 to 10, from 50 to 10. So the simplest way what you can do is if they are able to admit in hospital for a week, so we can do Snehapana with the Dadimadi Kridam, 3 to 5 days, depends upon situation, and go for normal Vamana with Madanapala, Pippali and all. If it is a female, definitely Dadimadi Kridam is better. If it is a male patient, I use more Indugandha Kridam also because Indugandham Kridam also very good for Agni improvement and situations. Also, it is having some androgenic advantages also. Whenever we get couples with a thyroid dysfunction, recently we had a case with a primary infertility with a male having hypothyroidism. We have done the Indugandha Kridam Sehabanam and followed by Vamana.
Sir, I have one more queries, please. One
Yeah.
more question. You especially for this, no? Rukshana, like you told, Udvartana, Shirodhara, Takradhara and Udvartana. Is it recommended before Vamana or post Vamana?
No, if we get the patient in the hospital, like admitted case, better after Vamana, you do this procedure. But sometime when we have a case of hypothyroidism, many people will not agree to get admitted in the hospital. So they want, but meantime they want to get reduce the symptom. So in the OPD level, we can prescribe Udvartana. It also bring good result.
Thank you.
Dr. Mohandas is raising his hand. Dr. Mohandas, you can ask, sir.
Yes, sir. Yes, sir. I'm Dr. Mohandas from Andhra Pradesh.
Okay, okay.
I have one question, sir. Suppose if the patient is hypothyroidic and along with
ഞാൻ ഡോക്ടറെ അടുത്ത് പോയിട്ട് വരാം. ചെറിയ നമ്മുടെ മരുന്ന് ചോദിച്ചിട്ട് നമ്മുടെ ഡോക്ടറെ അടുത്ത്
yes,
ഇപ്പൊ തന്നെ
yes,
വരും.
please.
ഞാൻ ഇന്റർനെറ്റ് കടയിൽ പറഞ്ഞിട്ട് വരാം നാളെ വരാന്ന്.
Yes, please. Can you
നമ്മുടെ
please silent?
തുറക്കത്ത് ചോദിച്ചിട്ട് വരാം.
Some
നാളെ എനിക്കത് ടൈപ്പ്
lady
ചെയ്യണം
is talking.
പ്രസന്റേഷൻ. അതെന്ത് വേണമെങ്കിൽ നാളെ വാങ്ങ്, കുഴപ്പമില്ല.
Someone is
Yes.
talking, please.
Yes, I am Dr. Mohandas calling from Andhra Pradesh. And as a patient is having hypothyroidism along with diabetes mellitus. Am I audible, sir?
Yeah, please,
Yes,
please.
yes, yes.
Yeah, please.
Yes. In those case, can we give along with these grutas, Dadimadi gruta, and along with that, can we give Amlakadi Asav to the diabetes patients? Because Amlakasav is is having very good antioxidant properties. Can we give the Amlakasav to the diabetes mellitus patients?
Yes. If we are using the SNA has a product called Amalakasva, which is actually it is an wonderful product taken from the idea of Prameha Chikitsa. There is a
Okay, sir.
line in Prameha Chikitsa called Sarvameheshu Paye Thatri Rasapludam Prane Haridram Akshiganidam. So Sarvameheshu, all Prameha, it is mentioned that Haridram, Haridram. That
Okay, sir.
so our Amalakasava is an excellent yoga. Of course, in diabetes hypothyroidism, Amalaki is also good.
Okay, sir. I am using this Amlakasava for debility and general weakness in the diabetes mellitus patients. So can I use it for long term also, for long run also?
Sure, sir. It is one of the very good product, and it brings very good result even for the long term patients.
Okay, sir. Okay. Okay, sir. Thank you very much, sir. And sir, could you please tell them to keep mute other people?
Yes, I will tell them. Wait.
Sir, otherwise you can mute others, sir. You can mute others.
ഒന്ന് ഓൾ മ്യൂട്ട് ചെയ്തോളൂ, എന്നിട്ട് ഓരോരുത്തരോട് ഹാൻഡ് റൈസ് ചെയ്യാൻ പറഞ്ഞോളൂ. കംപ്ലീറ്റ് മ്യൂട്ട് ചെയ്തിട്ട് മ്യൂട്ടോളൂ.
Me also. Okay. Sir, one more question, sir. This Dr. Mohandas. And one more question, sir. One more, not question, it's a doubt. Sir, can we have like a, suppose in allopathy they will give the L-troxin, right?
Yeah.
So like that, a universal medication in Ayurveda, can we use Kanchanar Gugulu for long term only in hypothyroidism?
Not really. I personally tried that in many cases, but just like modern medical approach, we cannot have one medicine, because actually even the modern medicine nowadays, it is completely failure in handling the thyroid dysfunction. Since I have been working in this field for now more than 7 or 8 years with many cases seen, the funniest thing is that if we give levothyroxine to the people for a certain period of time, they will have a biochemical balance. You know, if you look at the TSH level 20 or 50, T3, T4 abnormal, if you give levothyroxine, biochemically things will become normal. But patients still have the hair loss, all other classical symptoms of hypothyroidism will persist. Moreover, another complication happens is that after a period from 4 to 5 years, what happens is that all these people will have developed cellular resistance. As you know, in the diabetes, it is an established fact that people will develop insulin resistance. This is also happening exactly the same thing happening in thyroid dysfunction also. Still, studies are not came out very strongly on this context. So when cellular resistance happen, they really fail. They don't know what to do. So when we give Panchakolam Churnam will do wonderful, and it improves the condition from the cellular resistance. It gives more permeability of the even thyroxine to go deeper into the cell.
Thank you, sir. Thank you very much.
So you told about Shadanga Paniya, Vina Shunti, without a Shunti.
Yeah.
What is the efficacy of that drug with the Shunti and without Shunti?
I told
Why you remove Shunti?
why I removed that without Shundi in the hyperthyroidism, not hypo. Hyperthyroidism, you don't need that much of the Ushna Vyavai medicines in hyperthyroidism, but in hypothyroidism, definitely we need Shundi.
Sir, I am using Takradara with Shadanga Paniya, Vina Shunti, in case of hypothyroidism.
Yes, hypothyroidism. Yes, it is very good.
Yes,
Very good.
Takradara. And I am getting very good encouraging results in diabetes too,
Yes,
especially
absolutely.
insulin dependent. Insulin dependent.
I completely agree, doctor, because the advantage of this type of combination, especially when we do Takradara, still there are studies has to be conducted, but what it does basically is that it has a strong potential to stimulate the pituitary, hypothalamus, pituitary, gonadian axes, hypothalamus, pituitary, thyroid axes, and all. So because of these things, that is the reason why when we do Takradara, even only in the head, we have an influence in the skin disease. You can try the same Takradara in the psoriasis patient, or you have a eczema condition, very upper dominant condition. You can try, you will get good result.
Hello.
Hello, sir. Hello, sir.
Oh, Namaste, Ajit sir.
Namaste. Namaste. I want to clear one thing. A very good talk about this thyroid hyper, and very good approach towards the acne concept. Different that I also attend that it's in thyroid discussion also on session. This main thing I want to clear out that that Hamsapatyadi Kashayam I think is from my Vaidya Manorama, I think so.
Yeah.
Vaidya Manorama and Hamsapatyadi Kashayam can we give in this hyper and with the Kajanara Gulgulu. That which condition is not apt for that this thing. That's I want to know.
You remember Dr. Rajagopal sir was prescribing this medicine in early Ayurveda Samajam.
Yes, yes.
We were all together in the Samajam in the panel. It's a wonderful time when we are exploring this yoga. Actually, if we have initial phases of thyroid dysfunction, especially when we have cases of hypothyroidism, the history with less than 5 years, and the presentation that TSH is went up to 40 or 50, and maybe they are having some symptoms mostly localized in Rasa Raktadi Dhatu, Rasa Rakta mainly, and maybe some association with the Mamsa Dhadus like arthralgia, myalgia. At that situation, Hamsabatyadi works better. But if that disease manifestation go deeper to Mamsa, Meda, Asti, then instead of Hamsabatyadi, better is Guglu Tiktakam Kashaya. So initially Hamsabatyadi works well. For example, in Eshenne, what I do is that sometimes I mix Hamsavadyadi Kashayam with a Nimbamradasavam, because Nimbamradasavam is the same yogam of Gugulu Tiktakam Kashayam. So if we mix Hamsavadyadi with Nimbamradasavam, even in the chronic history of hypothyroidism, we can get good result.
Then one more thing. Rajaval sir usually prescribe this Chirulyadi Kashayam also in this in the thyroid condition. But actually, I don't know why he is prescribing. But once I asked him why sir you are prescribing Chirulyadi Kashayams in the ancestral side, you are giving to this thyroid condition, that the yogam itself is that for the Agni concept that you told today. That what you can that suggest for others about the Chirulyadi tribe. Could you mention?
Very, very true, sir. The thing is that whenever the dosha localized in the koshta, whenever the dosha restricted to koshta and which is not able to go outside and which hamper the agni, creating the ama and a sort of partial alana situation in the koshta, Chiruvalluadi will be the most simplest, the best effective medicine. Can even can reach anywhere. You know, even with the cervical spondylosis, if we give Chiruvalluadi, it will bring good result. When we have a Kavanabandhavastha, Shiju, I muted all because it's making a lot of disturbance to me.
Okay, fine, okay.
Now, we can, if Ajit sir want to say anything more, maybe he can unmute and say.
No. I got that you got very many different experience from your father is my guru also. That sir, and their different views without we simply the Galagandam only our concept. This the wide spectrum is not the inside this Galagandam. It's a very wide spectrum. We will talk about this thyroid and we can't correlate with this what is called the modern thyroid, modern concept and in Ayurveda. But we can reduce what the patient is in difficulty. We can reduce that only. We can for thyroid we can give this medicine for for thyroid or this specific medicines we can't state that. But anyway, your approach is right approach. The Agni with the Kabavada concept is we should adopt it. Otherwise, for giving kashayam, specific kashayam for this condition is not our concept. That's your speech enlightened others to go through that way. A very good. Thank you, sir. Thank you, sir, very much.
Thank you. Thank you.
Sir, I want to listen any Avaleha in thyroid in the management of thyroid.
Okay. When we have hyperthyroidism, there are avalehyas like Kushmanda Rasayanam, Amrita Prasham and all are very good hyperthyroidism. But when is in hypothyroidism, most of the avalehas which is having jaggery and other things are not good. Maybe in some cases I tried Deshamula Haridaki, also given some good result. But don't give for longer time because I found it's not so comfortable. But the small Haridaki is a good choice.
Is it in night, sir?
Yeah, one teaspoon in the around 7 o'clock or 8 o'clock like that.
Thank you, sir.
Maybe another medicine if the person is having urticaria, skin manifestations and thing. Another maybe Agastya Rasayanam. Some of the clinicians also uses Agastya Rasayanam. Also shows good result.
What is the limitation of Valium Madhusnuhi Rasayan? Madhusnuhi Rasayan.
Madhusnuhi can be tried, but the thing is that whenever we use Madhusnuhi and all, patient has to be strictly in Pathya. And when you have angioedemas, people hyperthyroidism complaining of continuous itching in the body and edemas, Madhusnuhi works very well.
Sorry, what strictly Patya you advise in Madhusmi Rasan? Like in general, what should we strictly maintain?
When we are prescribing Madhusnihi Rasayanam, the Kattu Amla Levana consumption should be minimized. Because the Madhusnihi Rasayanam is mentioned with a very strict diet restrictions like reducing Kattu Amla Levana. And so for thyroid dysfunction is concerned, we have to reduce the milk and other products also. And avoiding the non-vegetarian food, especially fried and oil content food has to be, and too much of exposure to sunlight, wind, cold also should be restricted. Because there are chances that many times Madhusuni Rasayana bring up with allergic manifestations because of the exaggerations of the Pitta in the system. And don't give to the Pitta Prakriti persons, then it will be problematic.
Next hand raise unmute.
Sir, about Rasasindura, I want to hear you a few words about Rasasindura.
You know very well that Rasasindura is such a nice medicine that can really go very deeper. I always combine Kasi Sabasma with the Rasasindura, or usually I combine Rasasindura with other things, because Rasasindura can take things very deep into the system because of its Sukshma, Tikshna, Vyavai, Guna. More than the real effect of Rasasindura, one of my purpose of choosing Rasasindura is to take the medicine to the target areas, especially to burn, to increase the Agni very well.
Thank you,
evening,
sir. We had very good discussion with you, sir, especially because I always remember Rasasindura when I am in confusion. In any disease, blindly I will put Rasasindura. Is it good practice, sir?
Yeah, but when already person is having lot of pitta too much, why you are better stop using the Rasasindura. Instead, use other medicine. Whenever you feel ama is there, Shrodha Shuddhi is needed, in the deeper level, then Rasasundara work well.
Good evening, sir. Can you hear me?
Yeah, please.
So myself, Dr. Sri Lakshmi, I'm practicing in Bangalore. So one time one patient approached me with a hypothyroidic lab test results, and it showed like TSH was greater than 100 and T3, T4 was normal. And the ultrasound showed like multinodular goiter. And when I checked with her the history of her diet and everything, she was telling that she consulted one allopathic doctor, and he informed her not to. There was no restriction for the green leafy vegetables as we usually say. So, what is your view in this condition, sir? Is it manageable in Ayurveda parallelly with allopathic medication? I would like to know more from this.
Since when she has this feeling of neck swelling, or does she doesn't feel at all? There's no swelling.
She was not feeling at all.
Okay. So what made her to check the T3, T4, TSH?
She just randomly went and checked because there was a thyroid function test in her office.
Is it was simply thyroiditis or nuclear goiter?
The impression was thyroiditis.
Okay. If this is actually, we have to reanalyze such situations. And how old she is?
She is like 30 plus, 33 or 34.
Okay. You see, there are basically thyroid enlargement not directly related to thyroid hormone dysfunction. Because a goiter or a enlargement of a thyroid gland gives a message that there is a period in a person's life where there is a dysfunction of the thyroid hormone. But if we check a thyroid hormone patient, thyroid goiter patient now, if they are not taking, even they are not taking medicine, it's very common to see these people also with a normal T3 for TSH. But at this case, when TSH is slightly high, that is 100 plus, and when you are finding thyroiditis, this case mostly mimicking to Hashimoto thyroiditis, an autoimmune condition of the gland. So you have to do one thing, that this case she has to do again another test called anti-TPO, thyroid peroxidase test. So, and if anti-TPO is high, it is a very confirmatory to say that she is having Hashimoto thyroiditis. It's not a common thyroiditis. If it is simple common thyroiditis, you just give some local applications. Parallelly, you start medications like Varanadi Kashayam, Kanjanara Gugulu, this type of medication. Her TSH will come down. But if she is already established, that's what I told the history. If she is already established the autoimmune manifestation, this will not happen one fine day. Anti-TPO shows that. If she establishes autoimmune conditions, you have to convince her that this is chronic autoimmune manifestation. You have to undergo longer period of treatment, maybe years together, to have medication. Okay.
Okay, sir. And how about the diet? In this case, diet plays a major role.
Yes, absolutely. That's an important thing I forgot to tell you. As I mentioned in the slide, that when even though she doesn't feel that she's lack of appetite, etc., but definitely all ama creating diet should be cut down. All agni aggravating food should be added. Absolutely, ama reduction is a big thing to be done.
Thank you so much, sir. It was really informative session. Thank you so much.
Okay, thank you.
Sir, good evening. Nice meeting you, sir, finally.
Oh, nice meeting you, Devikant.
I am Dr. Ravikant from Visakhapatnam. I'm practicing a private practitioner in Visakhapatnam since 9 years. I have an experience with treating hyperthyroidism case I want to share. I started using a Gandamala Kandan Rasa. There is one medicine called Gandamala Kandan Rasa.
Oh.
That is giving a very good result in acute cases. Whenever there is a higher TSH with patients having higher TSH, whenever I use Gandamala Kandan Rasa, it will come down very drastically. It comes down, the TSH levels are coming down very fast. That's one input I got it. And recently I started using your Hamsapatya, the Kashayam, since last 2 months. So I'm glad to see the results, experience with the patients. And another thing, recently I heard from a folklore practitioner that he is using Godanti Basma with Vibhidaki Churna. A simple combination of Godanti Basma and Vibhidaki Churna in treating thyroid patients. And he claims that he is getting very good results with that. All the thyroid, even for chronic cases, and he is using for long-term usage also. But I think we have to try that in practice. This is one small input I want to share with everyone here.
That's wonderful, Devikant. Godandi, I has also seen Godandi also having some result, especially Avipatti Churna with the Godandi Basma as a common prescription used when I was doing my post-graduation in SDM Ayurveda College, Udupi. So many of our teachers like Dr. Muralidhar Sharma and all, so he was using Avipatti and Godandi medicine.
I had seen in Udupi also, sir. I am also a product from the same college.
Okay. I studied in 2000.
Yeah, I was very much later student.
Yeah.
2008, I studied KCPG under Srinivas Acharya, sir.
Oh, me too. I was the first student of Srinivas Acharya. Oh, great to see you.
That's very nice, sir.
Srinivas Acharya sir was using Swayamagni Sinduram and for the hypothyroidism cases, and Muralidhar Sharma sir was using Avipatti Godandi. He was very in a different way he was treating the cases.
Sharma sir used to use Godanti Basma and Avapattikar Churnam and Kanchanar Guglu. These
Yes,
are the,
yes, very true.
and few patients I observed he is using Chandraprabhavati also along
Yes,
with Kanchanar.
very true, very true.
Given very good results in few cases. Those especially associated with any edema and all those things. The patients with who comes with edema and thyroid hypothyroidism or something. The Chandraprabhavati works very wonders in them. Very good results.
Sir, please share that Avipattikar and Godanti Basma, how to mix and doses, please.
Generally, in SDM Udupi or in my what I see, generally the Godanti Basma is used in 5 to 10 grams of ratio with 50 grams of Ayurvedic. It is the combination generally used by most of the practitioners. 5 to 10, depending on how much you are expecting the results from the patients. Like what kind of case the TSH levels, based on TSH levels. What I heard from this local folklore practitioner, he's a very old man, like he's a 80 to 90 years old person. He was using Vibhidaki Churnam along with Godanti Basma. It was also like giving very good results. He claims that he is giving very good results. I recently started using these medications last few weeks actually.
Oh, it's a great information.
Yet to see the result. Only Vibhidaki Churnam and Godanti Basma, only 2 ingredients.
Here in Kerala, some of the folk practitioners use the root of Lajjalu. The Mimosa pudica, that Lajjalu, the root they make paste, they apply in the neck. Some of the Adivasi, the tribal practitioners especially, they were using in the neck. And they were claiming that it has some good result.
In Andhra, people used to use Apamarga Mola Kalka as label.
Oh.
Like simple. From that they Apamarga Mola Kalkam.
Okay.
It is giving very good results in thyroid, especially that throat swelling and all. It's giving very good.
Hello, sir.
Yeah, Veena, doctor, please.
Yeah, I just want one advice, sir, from you regarding a case. A lady, she's around 50 years old, having multiple nodular goiter with all TSH T3, T4 levels normal, sir. But her swelling has been increasing. It's there since 1 to 1.5 years, sir. Do we have to treat this case, sir, or can we leave it like that? Because her her hormone parameters are normal.
This is, I think, this is what I mentioned in the case story, that even though the parameters may find normal, but there are situations where you see the size of the nodule can increase. So if there is a tendency to have an increase of the nodule, definitely we have to use some medication, even though all the biochemical parameters fall normal.
Okay, sir.
For example, if you take an ultrasound of the neck, saying that it is 10.1 centimeter, like that, the thyroid gland size, and after 6 months or 1 year, if there is a significant change in the size of the thyroid gland, then definitely you have to switch on to the medicines like Varanadika Shayam, Kanjanara Guglu, like these type of medicine for at least few months. And check it again, make sure that the size of the gland is reduced. Maybe also you may do some of the local application, as Dr. Revikant mentioned, like that some of the recommendation can also be done.
Okay, sir. Because she has already taken Kanchanara Gugulu from other Ayurvedic doctor, but she says there is no any changes. Kanchanara Gugulu and some other medication she took, she says, without any changes in her size of this thing.
Actually, the situation is happening is that the size can be felt, when you examine the thyroid gland, normally people will say, doctor, no, my thyroid gland is increased. Sometimes it is not really increased, rather it is their feeling, because they lose a lot of fat from the neck. When you put on weight, or somebody put on slightly weight, or there is a water retention in the neck, they feel that thyroid gland, it's disappeared. The enlargement is gone, and the vice versa too. So these are all their functional, I mean, their personal feeling. The size and other things has to be really measured with an ultrasound. Then only we can make a decision. People will say like that, doctor, I feel it is increasing. It's not increasing, rather they are losing the fat of the neck.
Okay. Okay, sir. Okay, sir. Thank you. Thank you, sir.
Okay.
Good evening, sir.
Yeah, please.
Sir, I have a doubt, sir, regarding one of my patients. So she's a 29-year-old female. So she's a known case of PCOD, and she's been on levothyroxine 75 mcg for the past 10 years. So now her current condition is like she's a chronic obese case, plus there's PCOD and the thyroid. So can you tell me a combination which will work for which can help in all the three conditions?
How old she is?
She's 29-year-old, sir. She's a mother. She has a child.
That she got married and having children, or any infertility issues?
No infertility issue. She has one child. She's married.
Okay. Why I ask this, because PCOD, hypothyroidism are like sisters. They coexist, and it's a challenging for a clinician to balance both these things. But I strongly recommend what you can do. There are two things you can do. If a patient is also, since the patient is also obese, try to give sesame oil snehapana, tila taila snehapana. If she is ready, she will get very good result. Do snehapana with a tila taila, plain tila taila, but don't tell the patient that you are giving plain tila taila. You say some vagbada taila. So let them, because they will think that, oh, why these people are doing some experiment with on my body with the sesame oil. So you say some name, but do with the plain, which is a very good quality of sesame oil. Do snehapana with a small dose. Maybe start with 10 or 15 ml, maybe go to 45 or 50 ml of sesame oil, 2-3 days. Then make a swedana and then go for a classical virechana first. Then on top of it, you do, after this virechana, you do Varanadi Kashayam and Kanjanara Guglu. Ask the patient to take Varanadi Kashayam, Kanjanara Guglu for a certain period of time. And parallelly also, you may use the medicines like Navagugulu, medicines like Shaddarna Churnam. All these are all very good, which can improve the Agni, reduce the Medas, also burn the Ama in the best way.
Okay, sir. Okay.
Okay.
Thank you so much.
Okay.
ഡോക്ടർ ആനന്ദിന് സിംഗിന് എന്തോ പറയുന്നല്ലോ.
Anand Singh Hussain, sir, you can now speak. Hello?
Please unmute him.
Yeah, already unmuted. Oh.
No, he's not unmuted.
Hello, sir.
Hello,
Anand
sir.
Singh, sir. You can speak now. Okay.
Sir, good evening. Sir, thank you for such a nice presentation of hyperthyroid disorder. Sir, I am medical officer in Uttarakhand. So I want to know about what preventive measures we can take, we can explain to the patient to prevent the outcome such as hyperthyroidism in future. How can we educate, people to prevent it?
It is very true that hypothyroidism disease also have some connection in genetically. For example, if mother is having hypothyroidism, there is a possibility to have hypothyroidism to the daughter. So if we find a hypothyroidism mother, and what we can recommend to the girl to prevent is to keep her Agni very, very strong. Simplest thing could be she could do once in a 6 months old, do mild virechana, like a simple Ayurvedic churna or like that, and to cut down the junk foods, especially the the junk foods of type of things that accumulate a lot of pharma in the system, or regular usage of some ginger water randomly could be of very, very, very helpful. But it doesn't need any direct medications, because keep Agni very well, that itself is enough.
Sir, one more question.
Yeah, please.
Sir, can you explain why most of females are affected with hypothyroidism according to Ayurveda?
Actually, it is a statistical information says that hypothyroidism is largely seen in the woman than the male, than the men. But there is no hypothesis to say that what may be the reason to have this.
Sir, in classical text it is mentioned.
You mean the thyroid dysfunction? No. In the classical book, if we can take some of the ideas from the Kabaja type of Pandu, then Vada Kabajwaram, like that Kaba type of Vadaraktam, some of the Vadarakta symptoms, like that. It's mixed in different chapters.
Thanks, sir.
Hello. Hello.
Thank you, sir. Thank you, madam.
Yeah, tell me, ma'am.
Yeah, please.
We can hear you.
Hello, good evening, sir. Actually, I have a patient. She is aged 36 years now. Hello. Whether I'm audible?
Yeah, but Nisha, can you mute all the people except Uma? Madam?
Yeah, 1 second.
Except Uma, madam, can you please mute?
Yes, 1 second. Uma ma'am, you can speak now. Unmute yourselves. Okay. Hello? Hello? Uma ma'am, are you there? You can unmute yourselves. Hello? Hello? Ma'am, can you hear me?
Next, Dr. Tejaswini, please, Nisha, Tejaswini Kudu.
Okay, next we have Dr. Tejasvi. You can speak now.
Hello, good evening, sir. Sir, actually, I had a patient. She is aged 36 years now. Initially, she had anxiety symptoms, sir. Actually, anxiety symptoms. But later on, she developed with irregular periods, and they have diagnosed with hypothyroidism. Then they have advised even L-Roxin, and she was under L-Roxin. But in later days, she developed with amenorrhea, sir. Since like 4 to 5 years, she's having amenorrhea. Then again, endocrinologist, they have diagnosed as primary ovarian insufficiency. So in this condition, what treatment protocol can be like?
Actually, this is happening due to extra thyroid gland pathology. That means that when you have some problem in the anterior, am I audible?
Yes, sir. Yes.
Okay. So what happens is that this thyroid disorder not happen from the problem of the thyroid gland. Rather, it comes from the outside the thyroid frame. That is the extra, outside the boundary of thyroid. Rather, it may be related with anterior pituitary. So if such situation comes, there are few things will happen. One is this amenorrhea might have happened due to the spontaneous atrophy of the ovaries. It is not very uncommon. I have seen few cases also that there is a spontaneous atrophy of ovary in many thyroid dysfunction cases, because the problem is not due to thyroid, it is due to the problem in the anterior pituitary. because hypothalamus pituitary gonadian axis is very vital connectivity which whole controls the reproductive system, including the ovarian ovaries and ovulations, etc. Actually, such cases, we don't need to treat the uterus or thyroid gland. Rather, we have to just address the symptoms and keep the lady continue some of the medication which keep them symptomatic relief, because it's related with the thyroid pituitary problem. It's not really easily treatable.
Okay, sir. Thank you.
Yeah.
Okay, next, Dr. Tejaswini, you can speak now.
Ma'am, myself, I asked the question. Hello.
Hello.
Ma'am, I asked just now. I asked the question now, ma'am. Myself,
Yeah.
Tejaswini.
You're done. You're done. The next person is I forgotten.
fine.
Uma madam.
Next,
I think
let's-
she was asking me. Uma madam, please unmute Uma madam.
She can unmute your, then herself. Sir.
Unmute Uma madam.
Yeah. It's already done. Ma madam, are you there? I think some range issues there. Okay, next we have Dr. Lalit online. I think he need to share something.
Good evening, sir.
Yeah, please.
I'm Dr. Lalit from Palwal. Please elaborate about subclinical hypothyroidism and its treatment.
Okay. By definition, the subclinical hypothyroidism is a condition where person will have a biochemical normalcy, but they will have many of the symptoms of hypothyroidism. That means T3, T4, TSH will be normal, but they will have many of the classical symptoms of hypothyroidism. So normally in subclinical hypothyroidism, they don't need to have levothyroxine. They don't need to have any other thing. Rather, we have to start the medications in a milder way to increase the Agni. Just like we have to do Langhana, Dipana, Pajana approach. So just like any disease where we have Amavastha is there, any disease where we have a lot of Shodho Shuddhi is needed, that approach, like using the Panchakola Churna, using according to the symptom. For example, the person is telling, I'm getting some neck pain, I'm feeling like very puffy in the body, I'm feeling edematous feelings there. You start with the Punarnavadi Kashayam, fine. If a person is telling, doctor, I have a hair loss, I'm losing, I'm feeling breathlessness, I'm feeling lack of energy, you start with the Drakshari Kashayam, like that. But again, you try to use very simple 1 or 2 medicines only and try to give longer period and check that the symptom reduces in a short period. But very importantly, that such cases should be repeatedly monitored, because once somebody manifests subclinical hypothyroidism, they have a high tendency to manifest as a clinical thyroidism. So every 3 months, you just ask them to go to a laboratory and check the status of TSH.
Excuse me, sir. One more question.
Yeah,
and
please.
for what we can give for depression
Due to thyroid dysfunction.
Right.
Actually, the thing is that when we have depression, other things, okay, we may try Vidaryadi Kashayam, we may try Swayamagni Sinduram, like that, but you have to give some counseling, you have to convince them that this depression may be come from a maladaptive problems in the family. You know, a female of 45 years, when she complains thyroid dysfunction, she says that I have body pain, I have some difficulties, I have no mood, many things. There will be a very sarcastic attitude from the husband or the family members. They will say that, oh, these are all very common. You have to work for the house, you have to focus about children, you have to focus about the husband activity. So there will be enormous pressure from the family members for the woman who's having hypothyroidism, and this sarcastic attitude from the family members really make her to have a big anxiety to meet the demand of the family members in everyday core of the life. So as the over a period of this anxiety will end up with, when you have a scale of increasing anxiety, a certain period of time, the next part of the anxiety is a depression. So they will have a negative graph which manifests with the depression. So we
Sir,
are in such situation, counseling and other things could be very effective.
one more thing, sir.
Yeah,
Can I
please.
have your number, please?
Sorry?
Can I have your number?
Okay. I think I have put it in the last slide, or I'll just type here in the chat box.
Okay. Thank you, sir.
Okay. Sir, Dr. Nambi, we have a few more questions, I think. One person, Dr. Sri Rama Shivakalyan, asking about treatment for multinodal goiter.
Okay. I will answer now.
Okay, another is.
Good evening.
Hello. Yeah. Tell me, ma'am, please.
Yeah, I am Dr. Sriba. Am I audible?
Yes. Hello. Please, ma'am.
Hello. Yeah, good evening.
Yeah,
Am I audible?
Yeah, I'm audible, please.
Yeah. Nambi in Hello.
Madam, I lost your conversation. Can you repeat what you told just now?
Yeah. I am Dr. Sriba.
Oh, again I lost.
Can you hear me?
Yeah, I can hear you. Yeah, please.
Yeah, I am Dr. Sribala. I am doing.
Yes.
Yeah. See, if we see like in getting in pregnant women, there is an increasing incidence of increase because they tend to work. We have a limited management. Shodhana karma. With this, even Google, we can't administer for long. What would be the special can we give?
Madam, I'm not heard totally your question, but I assume that you try to mention something about the limitations of the medication during pregnancy when we have thyroid dysfunction.
Yes.
So
Exactly.
Yeah, okay. The thing is that it is very, very important if the couple is planning for conception. It is the right time they have to think about thyroid dysfunction, and they should go for a routine checkup thyroid, and they have to correct the hormone. Once the pregnancy establishes, then thyroid dysfunction manifests. It is really very, very challenging, and we have a lot of limitation in giving medicine. I used to give Dadimadi Kridam. I used to give some of the medicines with a safe result, but still, I never withdrawn levothyroxine if the medical doctor recommended to consume this, because still we don't have any scientific data or evidence to say that many of our medicines are very competent enough even during the pregnancies. Whereas if they give levothyroxine, it is fine because they have their own method to prove that. Because I personally had some bad experience too. Let me tell you that there was a girl I was treating with the thyroid dysfunction, and everything become quite normal. And she herself decided to stop the medication without taking permission from me, because she thought that everything is fine, and she got married, and after a year she got conceived. And unfortunately the gynecologist doesn't check the T3 T4 TSH even before in the initial phase, and after third or fourth month they found there is some lacuna in the growth of the baby, including the nasal bone was not really developed, and she has to undergo a medical termination of pregnancy just because of her negligence in consuming the thyroid dysfunction medicine. So I was very upset when she informed me this story. It was not my mistake, rather it was the ignorance of the patient sometime also end up with big challenges.
That's a great experience, sir. I would like.
So it is when you are treating with the thyroid patient during the reproductive period, we have to be very, very careful because sometimes many of our sentences very loosely may end up with a problem because they will take it granted that, oh, I am taking Ayurvedic medicine, so it's not very big problem. It is, they will misunderstand because when a modern medical doctor say in a very serious mood, they will take it things very seriously. When they communicate with the Ayurvedic doctor, many times they will take it granted that, okay, we are in a more comfortable in comfortable person's hand and we can do whatever we want. This doctor is also a little bit flexible with us.
Yeah, that's true. That's here. Like, if we observe the proper Rutumati Charya, one previous history like thyroid, proper.
Yeah, proper
Well,
could be very good, madam. One thing I strongly recommend is that if somebody is suspecting thyroid dysfunctions and they are planning for conception or immediately after marriage, the simplest thing they can do is a simple Tilathaila Snehapana and a Virechana.
Okay.
It is not costly at all. They have to take just 1 week of leave and they just start taking Tilathaila instead of breakfast. Take Tilathaila for 10 or 15 ml and increase the dose whatever the amount they can go, maybe 45-50 ml for 5 or 6 days. Then stop 1 or 2 day Abhyanga Sweda simply in the home and go for a typical Virechana with an Avipatti Churna in a very good dosage, or a Icha Bedirasa, something like very Lekhana. That's all.
Okay.
This itself is enough, maybe, for many good result.
Okay. Thank you. Thank you so much, sir.
Thank you.
Okay, thank you, ma'am. Anyone need to share?
I think.
Yes, sir.
I think I'll answer some of the questions, like as Nisha mentioned. One
in the chat
one
box.
thing about
Treatment for
chat box
multinodular gout.
multinodular goiter. Okay, as I mentioned before, once the nodular goiter manifests, primarily we have to evaluate with ultrasound whether it is malignant or non-malignant. Because once it is a really malignant, better not to touch. Let us go for a surgery, whatever. Of course, we can do something once things are there. And that's one thing. Second thing, if it is a non-malignant, it is a simple nodular goiter. It may be affecting the one side or a partially goiter. It doesn't need much treatment. Of course, we can recommend some neck applications. If the biochemically things are normal, we can do some local applications and wait and see method. Okay, there is a gland, do ultrasound, check it the size and everything. No thyroiditis, there is no inflammatory changes, only a nodule is there. Then check it again after 3 months or 6 months, give some medications for that, check it after 3 months or 6 months. Make sure that the gland is not increasing. This is fine, no problem.
Okay, fine. And another is a question from Dr. Asiya Alauddin is that multinodular goiter, TSH 0.01, therads for 3 months in general medication, but no change in TSH, mild MM size increasing in USG. Endocrinologist suggests that no need of surgery. They are stopping levothyroxine, symptoms cured by our medication, but no change in biochemical values. Sir.
That's the thing. Once the nodular goiter happens, it is not as easy that it come back to the normal size very soon. If I go to a gymnasium and if I work out for 1 month for my biceps and triceps, definitely I have a hypertrophy of my biceps and triceps. If I go for a 3 months, it will become a quite good size. Then even if I stop for next 6 months, again still my biceps and triceps will have a sufficient hypertrophy, right? So similar way, once the thyroid gland increases as a goiter, a hypertrophy of the thyroid gland, it is not very easy to go back to the normal. It takes very very long time, maybe years together, but we have to check it that two things. One is thing that whether it is producing any autoimmune nature. Second thing, whether it is manifesting any cystic swelling like nodular goiter. Or third thing, whether it is changing its character into a malignancy.
Okay, fine, sir. And Dr. Nikita asked about how to manage hypothyroidism associated with PCOD and obesity and hyperlipidemia. Please advise.
Okay, I think hypothyroidism with PCOD, I already mentioned obesity and hyperlipidemia also, again, the sister of the same. Obesity, dyslipidemia are all the sister of the same. So the same common prescriptions like using Varanadi Kashayam, using Kanjanara Gugulu, these are all work together. These are all have a common Rasadhadu, Kapadosha and the Rasadhadu, Medohara Chikitsa, these are all common for all. So that prescription can be enough.
Okay, fine. Another, couldn't see the name of the doctor. Another question is, please explain detailed RX of MNG.
Sorry?
RX of MNG.
Okay, RX means treatment of
Morning, I think.
What is that?
Morning is a short name of MNG. Morning or
What is that MNG?
yeah.
I'm not able to see the chat box. Can you paste again to the chat box?
Yeah, fine. One second.
Sir, maybe it is multinodular goiter.
Okay, okay. You mean the MNG? Okay, I'm hearing.
Short form of short.
Okay, multinodular goiter. Okay. Oh, right. I was hearing MC. I was thinking something else. Okay, you mean the multinodular goiter? I think I already told about that.
Okay, fine.
Multinodular goiter. Just now I answered.
Okay, fine. Next is Dr. Okay, next question is, for how many days should we give Udvartana and Lekhana Vasti?
Okay, in the hospital setup, normally we start doing Udvartana in the first part of the treatment, Udvartana and Takradhara, for at least period of 7 days. Then again, depend upon the symptoms, then you progress for Vasti. Vasti could be the next choice of treatment. And so that through a 7 days of like yoga Vasti pattern, you give Sneha Vasti with Pipalyadi Anuvasana Tailam, or the oil what you want to give depends upon symptom. Then you go for a Lekhana Vasti for a 7 days. That is enough. Then you can, once the system is become better, then you can go for further treatment. Oral medications from the house.
Okay, so next is, can you share your valuable experience and therapy to be adapted in Hashimoto's thyroiditis?
Yeah, I think I already shown in the slide about the Hashimoto thyroiditis with prescriptions. I think you can note down those things from the slide. Hashimoto thyroiditis definitely needs years together treatment, not like a routine hypothyroidism, which can be treated in a short period of months, a few months, we can get very good result. But Hashimoto doesn't respond such a fast thing. It needs long time of treatment. Like we may use Gugulu Tiktakam Kashayam, Kanjanara Gugulu. Then may for Panchakarma could be very, very essential when we have an autoimmune disease.
Okay, next question is, is there any relevant to give immunity boosting drugs in hyperthyroidism?
Hyperthyroidism.
Yes.
Okay. Hyperthyroidism, you don't need to give immunity boosting, rather Pittavada Shamana medicines. Like you try to give Pittavada Shamana medicines will be important, like Kshidapaga, like Vidaryadiganam, like Drakshadiganam. This type of medicine will be very, very useful to reduce because the whole concept is there is a Atyagni, increased Agni is there. So you control the Agni, that is the thing.
Okay. Dr. Kanjan asked about for how many days we need to do Udvartana and Leganavasti. For how
7
many
days of Udvartana and 7 days of Yogavasti pattern.
Okay. And next question is, can you please explain the role of...
For
Sorry.
Bastis, which drug for Anvasana?
Pipalyadi
Like you
Anvasana Thailam will be very, very useful.
Okay. Can you please...
Can we administer Matra Bastis? Matra Basti.
Yes. The thing is that, as I mentioned before, if you are doing Lekhana Basti, it is good to do some Sneha Bastis. But if you're doing only Matra Basti, that's not very good. Because in thyroid functions, when you do only Matra Bastis, condition worsens. Hypothyroidism worsens.
So can you please explain the role of Nasya in hypothyroidism in general and Avanapida Nasya in particular?
Okay. Normally, when we have thyroid dysfunctions, Nasya has some role, especially stimulating the thyroid gland, also to regulating the hormone level. But as a day-to-day regular practices, it doesn't show much significant result. If it is a non-thyroid illness, like anterior pituitary issues, like a doctor mentioned before, such situation, Nasya could be more better. Not in the routine cases if you give Nasya, whereas Vamana and Virajana could be much more better.
Okay, fine. So can we manage hypothyroidism in pregnancy because it showed a normal thyroid function on preconceptional tests?
I think I answered that question
okay.
because I am answered in another way. I answered that question.
Next is hypothyroidism plus PCOD. Sorry, hypothyroidism plus PCOD plus hirsutism. 24 years treatment line.
Okay. Again, when you have hirsutism, which is a part of PCOD, or with acanthosis nigricans, these are all very part of the PCOD.
In thin patients, particularly for thin patients, she asked. In thin patient.
In thin patient. Okay. Okay. When we treat PCOD, is a wonderful topic. Actually, could be discussed very nicely, very interestingly, because PCOD with obese PCOD and lean PCOD, we have to categorize that into obese and lean PCOD, and it needs a long elaborative presentation is needed actually. But in short, I can say is that whatever you do in the hypothyroidism will be very much advantage for the PCOD too. Most of the medicines in hypothyroidism what we use have an influence in the PCOD. But when you are expecting correction in the hirsutism, which is a testosterone dominant presentation, like unwanted hair growth happens in the body and all, it doesn't go with these medicines. It needs Snehapana, Virajana, like very systemic corrections, which if the patient permits, definitely that could bring good result.
Okay.
Hello, sir. Hello, sir.
Yeah, please.
Sir, this is Dr. Shiva Kalyan. Thank you for a wonderful lecture, sir. Sir, my question is, when the biochemical parameters and also the symptoms are totally become normal in the hypothyroid cases, up to how many months or days we have to continue the treatment after everything comes to normal?
The half-life of the thyroid is the half-life. Half-life of the thyroid hormone is 6 weeks. 6 weeks. So normally, if you want to check a thyroid hormone level, once you checked anything, the best and most precise repetition should be at least after 3 months. That means 12 weeks after that. So if you find this 12 weeks, it is balanced for next successive another 2 more time. That means 3 months, 6 months, and 9 months. Successfully, if you find things are normal, then it is considered as now we don't need to do any more treatment. That means if you find 3 successive times normalcy, then it is normal. Doctor, you got it what I mean?
Yeah, yes, sir. So in these 9 months period, we have to give rasayanas only.
It depends. So you start with, for example, it depends upon the symptoms. You may start with the kapha shamana treatment initially, then you may address some pitta. You may address with, at the end, you may start with some rasayana like that.
Okay. Okay, sir. One more question, sir. Sir, is there any role of Vasa, Guduchyadi Kashayam in these hyper or hypo conditions?
In hyperthyroidism, it can Vasha Guduchyadi can Guduchyadi Kashayam also very good in hyperthyroidism, not hypo. Hyperthyroidism, Vasha Guduchyadi is also good.
Thank you, sir. Thank you.
Okay. Sir, we have one more question. Is it possible to diagnose thyroid problems based on Ayurvedic principle instead of lab report?
Yes, definitely. If you are actually, the funniest thing that the thyroid dysfunction, basically from a modern science, there is nothing called a diagnosis. What we call hypothyroidism is not a diagnosis. Rather, it is we are claiming that there is a pathological imbalance of the hormone in the system. It's not the real diagnosed name. Like we have a disease in thyroid like Graves' disease. We have Hashimoto thyroiditis. These are diseases. Hypothyroidism basically is not a disease. Literally, I mean the definition of the disease means in compared to hypothyroidism, and it is like just like we say high blood pressure, low blood pressure, because of when the BP apparatus manifested, we categorize the people, then low BP, 3 we are doing. But so for Ayurveda is concerned, we address the symptoms like problem in the Rasa Dhatu, Rasa Pradosha Vikara. We address this problem as Gada Vata. There is a Gada dosha, like Kaphe Rakte tu Pandutvam. If Kapha dosha travels into Rakta Dhatu, Ashtanga Sangra says there is a creation of Pandutvam. Pandu will happen. So like that, just like Vata goes to Rasa Gada Vata, Rakta Gada Vata, Mamsa Gada Vata, like that, when Kapha go to Rasa Dhatu, Kapha go to Rakta Dhatu, many of the thyroid dysfunction you can see. So initial diagnosis may be Rasa Gada Kapam, Rakta Gada Kapam, like that. No problem, we can do that.
Okay. So I think we have covered up all of our questions. So anybody need to share or need to ask anything more than this? So you can unmute your audio and ask the doctor.
Sir, one more question, sir. Sir, how to treat this hair loss in case of this hypothyroidism condition?
Hair loss already started taking some oil. I'm hearing the water oil sound. Okay. Okay, now it's stopped. Luckily that now the sound is stopped. Okay. Whenever there is a hair loss, there is a common tendency nowadays in the people to use different types of hair oils, coconut oil, medicated coconut oils. But if that hair loss is originated out of hypothyroidism, it is at least in the initial phase, it is useless to use hair oil. Rather, we have to correct the Agni. Then we start hair oil like Nirgundyadi coconut oil or Bhujagalada coconut oil. There are very good coconut oils which can really bring very good result. That like Nirgundyadi is very, very good. We have many oils like that can bring good result.
Okay, sir.
Okay.
Sir, and regarding the dietary aspect, generally they say cabbage, cauliflower, these are should not be taken by hypothyroid patients. So what about as per Ayurveda, cabbage and cauliflower?
The story of tapioca before the this cabbage and cauliflower. So for Kerala is concerned, we have a material called kappa or kolli, which is called tapioca, an underground stem modification, which is really against the thyroid dysfunction. Because many of the studies shows that this will create a sort of armor in the system like that. And again, of course, the cauliflower and the cabbage, these are also bad for thyroid because it creates a lot of metabolic armor in the system. According to Ayurveda, it's not cabbage or cauliflower. Anything that creates that cumulate armor should be avoided.
Okay. So
Logic is simple, and even not only cabbage, cauliflower, all the milk products has to be reduced in hypothyroidism.
So the hybrid varieties also maybe create armor. Hybrid variety.
Surely, I think so.
Okay. Thank you, sir. Thank you, sir.
Okay, I think our question
I think we have to wind up.
Okay, sir. Yeah, sure. So, great. Thank you, everyone. We appreciate you being here.